Hi, Dr. Mark Beaty here, Beaty Facial Plastic Surgery. One of the things we've been getting asked a lot lately is about tightening of the neck and jowl without surgery and what kind of procedures can be helpful for that. So I think the most important thing to understand is there are two issues in the neck and the jowl that we see for the most part. They are the underlying supportive tissue, which defines those contours, and the quality of the skin itself. So depending on what your particular problem is, there may be different procedures that would be the most appropriate for you. We can use microfocused ultrasound, a procedure called Ulthera, to help to tighten some of that underlying tissue, the things that I would tighten in a facelift procedure, for instance, and improve the contours of the jowl and neck. On the other hand, if the issue is more at the surface of the skin or skin laxity, then radiofrequency-based energy procedures like Profound or Pixel 8 can be more effective for achieving the skin tightening. And then in some of our patients, we find that combining these procedures can give the most improvement short of going that next step toward surgery. Hi, Dr. Beaty again. Another question that we get asked a lot is, can I use injectable filler to help with the appearance of the jawline? And the answer to that is yes. Fillers can be used very effectively to treat several areas of the jawline, including the prejowl sulcus, which is that little depression that happens right in front of the early formation of jowls. You can use it to strengthen the angle of the jaw and make that more pronounced and stronger looking. And we can use it also for chin augmentation. So fillers can be very effective at doing some subtle reshaping of the jaw. And the good news as well is that they last quite a long time in this area, usually yielding 12 to 18 months worth of effect. So the next question on today's list is about the lip flip. Let me start by saying lip flip is a marketing term, it's not a procedure. But what it refers to is using Botox to selectively control the muscles of the upper lip to get the lip to turn out a bit, which is something that many patients desire. I think the important thing to understand about this is that both injectable fillers and Botox can be used effectively to help enhance the appearance of patients' lips. This is an area that's quite popular, but it's an area that we also see some pretty distorted and unusual looks when people have this done by inexperienced injectors. So rather than focusing on terminology, I think the important thing with lips is to make sure that you have a good relationship with an experienced injector and that they understand what the goals you're trying to achieve are. And very, very satisfied patients is what we see with these procedures. The next question is about Kysse, Kysse. Kysse is the newest injectable product in the Restylane line from Galderma, and it is specifically made for lip augmentation. The idea being that it will volumize lips but maintain a very natural both appearance and feel to the lips. So we've been super happy with how this product works as a lip augmentation material, and I think it's something certainly to consider for patients' lip augmentation need. The next question is about under-eye filler and how it relates to dark circles. Under-eye filler is a great procedure for people who have formed little indentations or tear troughs in the area immediately under the lid. And what the filler does is it fills in that depression. So to the extent that what you see as a dark circle is related to shadowing over that little depression under the eye, using filler injections will help that a great deal. What filler injections won't change is the pigment of the skin around the eye. So in some cases, if part or all of what is seen as a dark circle is related to skin pigment, then fillers aren't going to help that. The next question is about duration of effect for injectable fillers in various areas. As a rule of thumb, The more mobile an area is, the shorter the duration of effect that a filler is going to last in that area. So as a rule, for highly mobile areas like the lips, we see roughly 6 months duration of effect. For areas like the nasolabial folds and the mobile parts of the lower face, it's more like 6 to 8 months. When we get into less mobile areas like the tear troughs or the mid-face for augmenting the cheekbones, there we can many times see up to a year duration of effect. And in highly immobile areas like placing filler along the jawline, we can sometimes get as long as 18 months duration. Our next question is, how do you know how much filler to use? Well, the real answer to that is you know how much filler to use when you achieve the facial appearance that looks good. This is why it's really important to have an experienced injector who has done a lot of filler and who's taken the time to have a thorough discussion with you, the patient, regarding what your goals and desired appearance are going to be. Then you can select the appropriate fillers in the appropriate amounts and achieve the effect that you have decided to shoot for. I think that increasingly we're seeing folks who have probably had a bit too much filler, and you get this distinct overinflated appearance to the face, and that can be avoided by, again, having a good understanding on the part of both the injector and the patient of what you're trying to shoot for with your aesthetic goals. And that gives me a good idea for a demonstration of how filler volumes work. I'll have to do that at home for you though. Hi, Dr. Beaty here. Wanted to show you a couple of things to give you an idea of how filler works and what kind of quantities are used when we inject filler in various parts of the face. So to start with, I want to give you an idea of how much filler there is in the different syringes we use. The most common size syringe that we use has 1 cc of filler. And I'm going to lay that out for you in a bead on this parchment paper. So that is the amount. This is sitting next to my hand. That is how big an average syringe of filler is. Now, sometimes we'll use smaller syringes of filler. The next most common size is 6/10 of a cc, and I'm going to lay that out right next to it. So this represents the typical amount of filler that you would get with most augmentation procedures. 1 cc syringe, 0.65 cc syringe. Now, I've pushed this directly out of the full-size syringe. When we're actually placing the filler, it is usually pushed through a 30 gauge needle, sometimes as large as a 27 gauge cannula. And what I want to show here is the size of the actual bead of material as it's being placed into the soft tissue of the face. And you can see that relative to the other beads that I lay. So if we were to use a threading technique, it would be something like this. The other thing that we'll often do is use an intermittent micro droplet technique, especially when we're doing deeper injections for things like cheek augmentation. So hopefully that gives just a little bit better idea of the actual volumes of material that are used when we're augmenting the face with injectable fillers.